Talking about Zika now, state officials are taking a precautionary measure on the heels of recent Zika cases in Utah and Florida. News 8's medical reporter Jocelyn Menta joins us now with what the state wants doctors and communities to do. Jocelyn.
And the state has been fairly proactive since the outbreak of Zika. I do want to stress the Zika cases in our state are all travel related, but several factors are behind today's announcement. There's that potential mosquito transmitted case in Florida. There's a baffling case in Utah, and that secondary carrier of Zika we've told you about has now been detected in Connecticut. So the state is instituting what it calls Sentinel Screening. This is the Asian tiger mosquito, which can be found in Connecticut. It's a secondary carrier of Zika, capable of carrying the virus. Specialized trapping since June show they are now in the state.
Thus far, we have trapped and tested over 90,000 mosquitoes that are collected in the state. These come into our laboratory on a daily basis. Thus far, we have found no mosquitoes infected with Zika virus.
The possibility of that happening, health experts say, is extremely low.
We do not expect mosquito transmission in Connecticut. If a local transmission were to occur in Connecticut, more likely would be sexual.
That's why the state will begin Sentinel Screening.
They are going to look for people who report similar symptoms to the virus, who don't say that they have necessarily been to a place where it's being transmitted, and they're going to test them for the virus.
They'll be testing 10 individuals a week, 16 years and older, as a precautionary measure. The focus will be Lower Fairfield and New Haven counties, where the Asian tiger could emerge and where segments of the population visit Zika-stricken regions. So far, all the reported Connecticut cases are travel-related, closely monitored.
We have established a registry for pregnant women who have contracted the disease, and we also have a registry in place to track babies after they are born. So far, no one has been born with any birth defect.
The state is funding the screening, but does anticipate federal funds as well. Testing will begin in community health centers in Stamford, Stratford, and Bridgeport. Hospitals will also be involved. Something else they announced today, the first mosquitoes this summer with West Nile virus have been found in Stamford. So be sure to protect yourself with proper clothing, insect repellent, and get rid of that standing water.